This segment of Delmarva Life is brought to you by Community Behavioral Health.
In today's society, being an involved parent is a worthy goal. You want to be sure your child knows you care about them and support them any way you can through their journey through childhood and adolescence. But let's face it, life is not easy. It's not fair. And since we can't change the world to suit our children, we need to make sure they're prepared for things like disappointment, even failure. Well, recent research shows not only are we not doing that, we may be creating children and eventually adults with anxiety issues. And that's a lot to unpack. So we welcome Dr. Suni Jani to help us out. She's a board certified child, adolescent, and adult psychiatrist with Community Behavioral Health. Thank you for being here this afternoon.
Thank you for having me.
So on the surface, it seems like parents are trying their best to be good parents, but in some cases may be creating the opposite effect. And what we want to stress is there is nothing bad about being an involved parent.
No, there's nothing wrong. I mean, that's really the goal of parenting, is to be involved with the child you have. So that's totally fine.
That's totally fine. But then you can be almost too involved, and that's what some refer to as helicopter parenting.
Yes, so I think that term's been around, I think, since the 60s, and it refers to parents who are maybe getting in the way of their child's developmental goals by doing them for them, I think is probably the broadest way to explain that. But a lot of people, when they think of helicopter parents, are the ones that show up every single day at school and are like, I made him his lunch because the school lunch isn't good enough. And it's to a point that sometimes the child can't seem to do things that are expected of their age because the parent is starting to do it for them, and often unintentionally.
So. Is that where the anxiety starts to set in?
So there have been some studies that have linked a lot of children with social anxiety and anxiety type disorders with parenting that's more involved than necessary. But sometimes we look at these studies with a sort of chicken or egg effect, because sometimes if you have an anxious child, your parental instinct is going to be, well, I need to do something because my child is not doing it themselves, and I'm really worried that the outcome of their actions might be life-altering. I have to do it. And you are supposed to be involved in certain aspects of your child's life, and it's really hard to know when you shouldn't be involved.
Are there signs that your child may have anxiety issues?
So what happens is, when we say something is a mild issue versus an actual disorder is what's crucial here. So there might be a child with a temperament. So a temperament's kind of the biological building block of a personality. So there's some kids who happen to be a little bit more inhibited, not really expressive, need to be pushed a little bit, and that's fine if that's your temperament. What's important is to be a good fit parent for your child's need at the time. So even if they're showing a little bit of fear of jumping into a pool, going to a sleepover, that's fine. It's just about meeting them where they're at and trying to encourage them to come out of these shells at certain times, because we all have to, maybe we might have to swim at some point in our lives, and it's important for them to learn certain things. When it's kind of an anxiety issue that we consider more on a clinical scale and it's a disorder, it's when it's far too hard to make friends to a point that they're fearful of dealing with any individual. If school is being impacted because they're terrified of going to school, that's impacting someone's growth, development, and learning, and that's when we'll actually go, okay, let's look at every factor in this child's life and what can be done to help them, because now we're looking at a disorder.
Okay, so back to the anxiety, the slight anxiety, the normal stuff. Is there a point where, in certain circumstances, it's okay to watch our children try their hardest and maybe fail?
Yeah, it's hard to say yes to that, but yeah, it's okay to watch your child fail. What's not okay is watching anyone in your life, including your child, go to a really life-altering or threatening or something that might be impacting their safety issue. So, you can try out for a play, not get the lead, be in a lot of pain from it. It's fine.
Yeah.
And but if it went a little bit more than that, if it was anxiety to the point that they're avoiding everyone and everything, absolutely get involved.
Yeah, and those are probably the red flags of anxiety. Absolutely. Is when they're avoiding everything. Okay, so what if you've been raising your child and you're getting into the teenage years and you realize, oh my goodness, I have been my child is anxious and I may be to blame. can you change that?
Yep, there's always, any of us can change at any time. Just like people with anxiety can make some different choices to be able to deal with their anxiety better. Sometimes, parents who are such a big part of any child's life, they can make little changes in the way they interact with their child, and there's never a point that they can't do this. It's never too late. People can always change for the better.
Yeah. Very interesting indeed. All right, Dr. Suni Johnny, thank you so much with Community Behavioral Health. Thank you so much.
You're welcome.
All right.